So next, I request
you, Dr. Deepa Raje. I am Dr. Anusha. I am here to introduce Dr. Manisha Chopra. Dr. Manisha is a very successful homeopathy doctor and has been a topper of university. She completed her BHMS from Shivaji University, Maharashtra. She has worked as associate doctor under Dr. Ajit Kulkarni and Dr. B.D. Patel and is presently the founder of Eye Care Homeo Clinic in Jayanagar since 15 years. She has been providing free medical consultation and homeopathy treatment for women every Tuesday at Therapant Bhavan, Gandhinagar from 7 years. She has held many medical camps and has been very active in conducting seminars in and around Bangalore on women-related health problems. She has been treating Jain sadhus and sadhvis across India. She is the Joint Secretary of Karnataka Qualified Homeopathic Doctors Association. She actively took part in COVID-19 pandemic healthcare line and distributed free immune booster to 5,000 plus people. Thank you. Over to you, Dr. Manisha.
Thank you, Dr. Anusha, for giving such a wonderful introduction.
and happy birthday, doctor.
Thank you so much. Here, I want to thank so many, you can say so many celebrities here. First, Dr. B.D. Patel, sir. So after my completion of graduation, I was not able to start my practice because of family commitments. So 10 years gap was there and I planned to start my clinic. So before that, I thought I should join to some knowledgeable person so that I'll be able to start my clinic. And some of doctor from Maharashtra, he referred me to Dr. B.D. Patel, sir. So my journey of practice started with sir. So I'm wishing you, sir, very happy Teachers Day and bow down for your all the motivation and inspiration. Second person I want to thank is Dr. Shripad Hegde, sir, the president of KQHDA. Sir called me one day and told me that Manisha, you are the speaker for next session, next webinar, and are you free on 5th September? I said, sir, that is my birthday, and you are asking me to present on the same day. So sir told ki, yeah, and I also accepted it, and I'm feeling very lucky. Ki this day is memorable for me. On the day of birthday, I'm presenting the cases because earlier Deepa Raje approached me twice or thrice for the physical CMEs. Ki Manisha, you give the session on. Actually, I was giving the session to many of our Jain communities and sadhvishis on how to keep your body alkaline. So she told me, why can't you give this session in our association? I said, and anyhow, some or other reason I was not able to give. So I really thank Deepa Raje also for motivating me and inspiring me. So thank you, Shripad Hegde, sir. And I wish you very happy Teachers Day and bow down. So next person is Swami, sir. So there is one small incident. What used to happen, ki every month, first Sundays are CME. And during that, sir used to say me that, Manisha, please give introduction of speaker. So I used to tell sir, every time you are asking me to give introduction, one day is going to come that someone will give my introduction. And this day is today's day where Dr. Anusha has given my introduction. So thank you, Swami, sir. Because of your motivation and inspiration.
Manisha,
Yes, sir. Huh? Yes, sir. Yes, sir. So I don't know you recall or not, but I recall properly ki I have spoken all this to you, and today is the day where the things are working really well. And thank you, sir, for inspiring me and motivating me.
Thank you.
So I will start with my session. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param Brahma, Tasme Shri Guruve Namaha. गुरु ही ब्रह्मा है, गुरु ही विष्णु है, गुरु ही शंकर है, गुरु ही साक्षात परब्रह्म है. ऐसे गुरुओं को मैं नमन करती हूँ. एज बीडी पटेल सर टोल्ड अर्लियर कि अहंकार नहीं आना चाहिए. So it's for all. In our Jainism, this is the best quality one can have. So I really thank you, sir, for every word of you is really for me, it is motivation, inspiration. I will try to practically implement in my life to become this egoless, and this ahankar will not come near to me. I promise you, sir. On this Teachers' Day, I can give you the gift of saying this. This is mainly for Shripad Hegde, sir. Thank you for challenging me to be the best version of myself. Sir, are you listening to this?
Yeah, I am there. I am there with you.
Yeah. Sir, why I want to tell you is that as you asked me for the, becoming speaker for this presentation on clinical cases, trust me, sir, I have never been into such kind of presentation. This is the first thing which I am doing. And I was so nervous because I don't have any case records and all. So I felt it was so important to keep case records along with the reports and all. So today I learned this thing that case records are very important. We give so many good results with homeopathy, but when we have these case records, we can show to the world, we can go digitally very much visible with our results so that homeopathy can reach to the heights. Already people are aware about it, but then also this record keeping and these things will really help our homeopathy to grow to the heights, sir. Thank you so much, sir. And all the teachers, I'm wishing happy Teachers' Day. So I'll start with my case presentations. This is the case of urinary tract infection. There was 8 months old baby, came with the history of high grade fever since 1 month. And this case came towards me during the first wave of COVID pandemic, near about September, October month. And every investigation was normal, like COVID, dengue, typhoid, but only the urinary examination showed the urinary tract infection. So he had been shown to many pediatricians. All of them had prescribed different antibiotics, but still the fever was not coming down. So I observed child was very cranky, and when laid down on the examination table, he started crying loudly and he was throwing tantrums. But one thing I noticed that when I made him lie down on the examination table, he himself turned and lied on his abdomen. So this was very important. This was peculiar symptom for me. And history given by mother was, his mother told he stops crying whenever he lies on his abdomen. He likes fruits also and he demands for water. So on this basis, and after repertorizing, I prescribed Medorinum 1M single dose and followed by SL for 5 days. I advised them to bring routine urine examination for next visit. So next visit, child was very comfortable, no fever, and urine examination was absolutely normal. So here, this Medorinum has worked wonderfully. And Medorinum is such a wonderful nosode. It works wonderfully in renal pathologies. Medorinum is strong remedy for renal pathologies, especially benign kidney disease. Many of the patient with the chronic renal failure, if they approaches me with their high serum creatinine, I usually prescribe Medorinum initially so that their serum creatinine will come down. Of course, I will try to match totality and then give, but I have seen many cases of chronic renal failure responding well with this Medorinum. Not only chronic renal failure, other symptoms are there, renal calculi, then benign renal diseases. All these are wonderfully treated with Medorinum. So this was my first case. I'm going little fast because time constraint is there. So second case I'm going to tell you about is case of multiple lumps in right breast. So she, 28-year-old female, came with the complaint pain in her right breast, and that pain was there since 3 months. And typical modalities were there, aggravation by touch, and very important modality what I found was aggravation during menses. And she used to feel better by warm application. In her past history, there was chronic coryza with turbinate hypertrophy was there. And ENT doctor has suggested her surgery, but she did not undergo the surgery. She came to me for the treatment. So main concern was her right breast limb, but that was in history I came to know about chronic coryza and all. Thermally she chilly, Sweating of palms and soles were there. And she wanted always warm drink to drink because she told me particularly, doctor, if I drink warm liquid, she feels better. So every day she used to drink warm water. So after investigating with her life space, I got to know about her mental rubrics. Those where she's very fastidious. There is a typical aggravation consolation was there. She described me wonderfully. Doctor, if I'm not in good mood or if I'm angry, if someone comes and consolate me, I get more irritated. And there was very much this anticipatory anxiety was evident because when she was telling the history, her palms were sweating. And I asked her also. So she told, yeah, I have this nervousness and I have this anticipatory anxiety. During school days, also before exam, she used to get this sweating of palms. On examination, it was found that there were 3 small size lumps. Those were very hard and painful. Sonomammography report shows right breast fibroadenoma with mild focal mastitis. So after hepatizing, I prescribed Cilicia 200 single dose and placebo for 1 month. So first follow-up, when she came back, she told doctor pain is reduced by 50%. Then again, I repeated Cilicia 200 followed by SL for 1 month. Second follow-up, pain reduced further. On examination, size of lumps reduced considerably. I gave tuberculinum 1M as an intercurrent. As there was a past history of turbinate hypertrophy, I planned to give tuberculinum 1M as an intercurrent. Third follow-up, she came with the sonomammography report and it came normal. So I'm running little fast due to time constraint. The third case is of mesenteric lymphadenitis. 10-year-old girl came with the complaint of vague abdominal pain since 3 months. So she came with her mother and mother told that she's not eating food properly. She has lost her weight also. And every time after eating little quantity of food, she is complaining of pain. And appetite also was reduced. And there is history of chronic cold with sneezing. So that abdominal pain was dull aching, that was not severe, but that pain usually starts after food. So family history of tuberculosis, her grandmother was suffering from tuberculosis. In her past history, she used to suffer with frequent urine infections. After going through her life space investigation, she told me that she's having fear of animals, particularly dogs. There I again confirm why sometimes dog has bitten you or no. So then she told no. Her mother told that she is really scared of dogs. She will not go near to dog, or whenever dogs are there, she will not go down to play also. She stays in apartment. So fear of darkness was also there. She looks very smart. She is very affectionate and she likes traveling. She's very restless. Once she entered my cabin, she was not ready to sit at one place. She was looking here and there, going around. So that was again for the hyperactiveness and restlessness. In general, her mother told that she is again having profuse perspiration all over the body, and she asked for the cold milk. There is a strong desire for cold milk. So after hepatizing, I prescribed tuberculinum 1M, that too single dose, followed by SL for a month. After a month, she came back. She told doctor, my pain has gone completely. Only 20 to 30% is there. Appetite improved and she gained weight also. Then I continued SL for another 1 month. So here I want to share one beautiful poem on tuberculinum. So that poem has been written by Gay Wilson. So I will share that poem. A tome to tuberculinum. This little girl could be good as gold, but also a devil, I have been told. Her mother says when they are just going out, valuable ornaments she would throw about. She was always catching terrible colds. Her granny had TB, didn't live to be old. Her face is just like a china doll's until she bangs it on the walls. No, she says to all you ask, excepting cold milk in a glass. Of dogs and cats, she has great fear. If she has a knife in her hand, don't go near. Screams at night and has cold feet. Her falling in love was so divine. until father said no, and she did fine. Once old enough, she traveled abroad with the same partner. She then get bored. Of mountain air and pine she's fond, hates storms seashore and stagnant pond. A hairy triangle on her back is found, hates the smell of coffee freshly ground. But to drink it, she's perfectly able, eats pork and fat if it is on the table. She's traveled till her energy spent from carrying suitcases, her back is bent. She's become superstitious and fussy about things. When she talks, she's sure she's forgotten something. She's frightened of being shut away. Changes her job, responsibility to alley. Her hay fever's worse and her asthma too. She gets headaches on Sundays and her sclerotics are blue. Such a wonderful poem written by Gay Wilson on tuberculinum. This poetry contains each and every symptoms of tuberculinum, and if we remember this poetry, we'll be able to match with the totalitarian and surely prescribe tuberculinum for the tuberculinum case. So next case is case of precocious puberty. 8-year-old girl came. She came with her mother, and mother mainly told me that she is developing secondary sexual characters, and just she completed 7 and she was in her 8 years of age. And when mother was giving history, so patient started crying, and she stopped her from explaining further. She was feeling very irritable as mother was explaining that she has developing secondary sexual character so early. So clear-cut case of precocious puberty. So when I inquired about her mentals, I got to know that she's very restless, hyperactive, she's irritable, and she always talks like a grown-up. She was having strong desire for lemons and desire for sweets. There was again sweating of palms and soles. This profuse perspiration was there for her. But this desire for lemon was so peculiar that her mother was explaining for every food item she needs lemon. And if she sees lemon, she will not leave it. She will try to eat that lemon whole with the peel. So such a strong desire for lemon was there. So after repetization, I prescribed Merxol 200 single dose. In FATAC's repertory, if you go through the rubric precocious, you'll be getting only 2 remedies. Those are Lycopodium and Merxol. So most of her genres also and totality of the case was demanding Merxol in this case. So I prescribed Merxol 200. So again, her only one follow-up has happened. So in that follow-up, her mother told that she is now mentally also feeling better because she was having that kind of stigma ki I'm developing so early and all, girl itself. So now secondary sexual characters are not developing that fast, her mother told. And I'm planning to give carcinosin 1M as intercurrent remedy maybe after 2 months. So this was the case of precocious puberty. The next case of bedwetting, nocturnal enuresis. A 10-year-old boy came with the complaint of bedwetting. Frequent cold and dry cough also he was suffering with the reduced appetite. When I inquired about his life space, I got to know mainly his mother came along with him. So mother explained about his nature and all. So rubrics I took was obstinate. There was violent anger, throwing the things in anger. He was sympathetic. Mother told that he's having such a helpful nature. If anyone asks his own precious things, those things also he will share. So he was very sympathetic and compassionate, and towards animals also he was having sympathy. So one important rubric was that fear of being alone in the dark or fear of going to the bed alone. He needs every time someone to go to bed, and he was very hyperactive. In general, I got to know that he has aversion to sweets and he was having profuse sweating all over the body. I prescribed remedy causticum 200 single dose after repetization. Second visit, bedwetting completely stopped. Usually for bedwetting, what other remedies will come in our mind is like Lycopodium, belladonna, Sina, sepia. But his case was completely matching to causticum as totality was completely matching to causticum. So this medicine worked wonderfully. In first follow-up only, I got good result. So next case is case of ganglion of wrist. So 35-year-old female came with the complaint of ganglion, and there was small ball-like swelling on the wrist. That was right side. There was aggravation on pressure, work, and extending hand. And she was having another complaint of gastric indigestion. She complained of bloating and burping. So that usually this gastric started after delivery. And she was like, if she's fasting, she'll be aggravated and she'll be getting more of burps and bloated. So again, third complaint was dust allergy, that is sneezing, aggravated morning. For her mentals, I got this fear of narrow places, claustrophobia. She is very inquisitive and irritable. Generals, thermally she is hot, desire for coffee and sweets. So in this case, one thing happened was I told her in homeopathic treatment, we usually ask for to restrict coffee. She told I can leave everything, but I can't leave coffee. Then I said, I can't take your case and I can't give you the medicines. But she told doctor, today you give me, you pack the dose and give me, I will go drink 3 to 4 cups of coffee and then from tomorrow I'll start the medicines. Then I allowed her. I gave her sulfur 200 after repetization and follow up after month, ganglion size reduced by 50%. In ganglion also, what happens ki usually we'll think about silica, calcarea floor, rustox, ruta, but this case completely after repetization, sulfur was coming from. So I thought this time I have to give sulfur only and see the results. And results were wonderful. After 1 month, ganglion size reduced by 50%. So I'm treating many cases of infertility. So here I want to share some of my clinical experience wherein there is an unexplained primary and secondary infertility. All the reports of husband and wife, both reports are normal, but they are not able to conceive. In these cases, what I do is I give the dose of folliculinum 200 on the 10th day of menstrual cycle, and it gives wonderful result. It happened for me at least 8 to 10 ladies. I give just dose of folliculinum 200 on the 10th day of menstrual cycle, provided reports are normal, her periods are normal, and it gives you wonderful results. So many females conceive only with this folliculinum. And other infertility cases also I want to talk about is, I usually follow one protocol, and that protocol also gives wonderful results. 10 to 12 years of primary infertility, even secondary infertility. Medorinum also works wonderfully, but I usually give protocol, that is Lees-Layer's protocol. I want to share about that protocol because what happens, in infertility cases, already those females had been to IUI, IVF, so much of torture is there, hormonal injections and all. So what I feel, no doubt totality is important and constitutional medicine works, but already they are loaded with so many allopathic medications. So I start with Lees-Layer protocol, and that protocol really helped me in many of the cases of infertility. I usually tell them to continue for 4 to 5 cycles, and maybe some females conceive in first cycle, some females conceive in third cycle, like that. So in that, what I'll be doing is, according to the days of periods, I will call them and give the doses. So weekly once, 7th day of periods, I will give Natramur to Natramur 30 potency. That is 1 dose. So that will be 7th day, 14th day, 21st day, and 28th day. So that is weekly once. This is according to the days of periods. Then I will be giving 10th day folliculinum 200 single doses. After that, from 8th day to 16th day, I'll be giving borax 30, and that is also 1 dose in a day, from 8th day of periods till 16th day of periods. Every morning and every evening, I'll be giving, for morning, I'll be giving pulsatilla 30, evening, I'll be giving sepia 30. So with these medicines, and I'm following this Lees-Layer's protocol in this infertility cases, and it is helping me a lot to treat infertility cases. So this thing I really wanted to share on this platform. So the thing is, I do classical practice, single medicine, single dose, whatever cases I have described, you might have seen there I have used only single medicine. I have given placebo for 1 month. My patients were asking me, doctor, your session is there, we want to watch. I said, I can't give that link to my patients because everywhere there is SL for 1 month and they are going to ask me after the session, doctor, you are giving only single dose, other things are happy pills or what? So I don't want these things to be open in front of patients. So I do this classical practice, but along with this, infertility cases wherein IUI, IVF is not working, but our protocols are working, then why we should not use these protocols? So all about my cases. Thank you so much. I think I am within time only. I've finished